Hello and welcome to Pisgah Health Today. My name is Angela Owen and it is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. We have 2 very special guests today. They serve as co-executive directors for Babies Need Bottoms, the diaper bank in Asheville, North Carolina. So today we have with us Megan Lemena. Did I pronounce that last name even close to correct there, Megan?
You got it, yes.
Welcome to the program. And along with her, we have Alicia Heacock. Welcome to our program today, Alicia. So Megan brings with her, she is a social worker by training. She has a master's in social and public health and really brings that public health side to the executive director component. And Alicia is a specialty in nonprofit and fundraising professional. She has a background that ranges in museums, science centers, and arts, and she brings the organizational component. And they both said that they basically share the same brain, 2 people working together, and just really excited to have you both here on the program. And Megan, why don't you start by telling us a little bit about the organization?
Sure, thank you. So Babies Need Bottoms was founded in 2017 in November, so this is our 3-year anniversary. Our founders had moved to Western North Carolina and realized that there was no diaper bank here. And so they got things started slowly but surely. We had a few partner organizations and built this wonderful model. And last August in 2019, Alicia and I took over. We'd been serving on the board and the founders stepped away and we took over in leadership. So we are a nonprofit diaper bank from a partnership model, meaning that we have organizational partners who serve the community. We provide diapers to them. And they provide individual families and the reason that diaper banks even need to exist and why we use this model is because diapers are incredibly expensive. If you don't have children, that might not be something, you might sort of have a sense of that, but when you have children, you know just how much money you're actually spending and how often you're changing a baby's diaper. So they cost lots of money. Diapers are not covered by any federal assistance program. So you can't, if you receive Medicaid for your health insurance, if you receive food assistance, those programs, you can't use those for diapers. And diapers cost on average about $80 a month. Children wear diapers anywhere from birth to age 5 or sometimes beyond that. And so it's a huge monthly expense for families. And we know that in Western North Carolina, especially.
Megan, I think you're freezing up there just a little bit. So it seems that your video is frozen. So Alicia, why don't you bridge in and just kind of restate? Oh, oops, she's back here. Can you hear us, Megan? It seems like your video might be freezing a little bit.
Oh, I'm sorry. I'm here. Yeah, can you hear me?
We can hear you now. So I want to make sure that the viewers don't miss the mission. Can you just restate the mission of Babies Need Bottoms?
Sure. So our mission is to work in partnership to provide diapers to families who are struggling with diaper need. Diaper need is an inability. Am I still? Have I lost you?
You're fine. Just carry on. We'll make work.
So diaper need is not having enough diapers or a sufficient supply of diapers to keep your child clean, dry, and healthy. Meaning that you don't have enough to change your baby when they need a diaper change, or enough wipes or enough supplies so that you can do it in a healthy way.
Well stated, and hopefully our viewers can pick up on that. Also, one of the challenges of Western North Carolina can be that broadband and the stability there. Alicia, why don't you bridge in and tell our viewers, how does the grant that you recently received from Pisgah Health Foundation, how will that help you in meeting the needs of Western North Carolina?
Thanks. Yeah, so I have to start by prefacing that we wrote this grant before COVID happened, right? So I'm sure that every nonprofit in our region and across the world is facing the same challenge, where we wrote this grant with an intention that we were going to distribute a stretch goal of 100,000 diapers in 2020. And we had done about 35,000 diapers per year prior to that. So this was going to be a huge jump for us to go from, we actually did 37,000 diapers in 2019. We wanted to get to 100,000 diapers in 2020. And so we wrote this grant for Pisgah Health Foundation to help us meet that goal. It was going to allow us to expand from distributing about 5,000 diapers per month to about 12,000 diapers per month to the 15 organizations that we were currently partnering with, and expand to a wait list of 7 organizations. Well, in March, everything changed. We pivoted immediately and we liquidated our inventory because we didn't know if we were going to have access to our diapers anymore. The local grocery store shelves were literally bare of diapers. They were literally bare of wipes because everyone was so concerned about the toilet paper shortage. Well, there was not really much mention that there was also a baby wipe shortage and a diaper shortage. And so can you imagine, you don't have resources to go buy the big box or even order them to have them delivered to your door. You go to the store and there's nothing to buy. So we liquidated everything we had. We immediately opened up our wait list and we gave diapers to everyone that we knew was serving clients' families, babies, that we could, to get diapers immediately out. So our partnership models swiftly changed from, we had 15 partners at the beginning of the year. We're serving over 50 partners today.
Wow.
It's jumped from a monthly distribution of 5,000 diapers to between 18,000 and 20,000 diapers today. We've already distributed over 155,000 diapers in 2020, and we project a 350% increase annually from 2019 to 2020. And I think something that's really important for everyone to know is that it's not just us in Western North Carolina. We're members of 2 national networks, one that's based in LA, one that's based in Connecticut, that are constantly surveying and talking to diaper banks across the country. And on average, between 200% and 400% is what diaper banks are seeing that the increase in need has been as a result of the pandemic.
That is an incredible change. And I just applaud the work that I know it's had to have gone on behind the scenes to be able to meet such a drastic change, to go up so very much. So that's incredible. And also, thank you for highlighting that for our viewers. Most of us are not aware, and we don't think about, if we don't have a little one at home, we don't think about the challenges of finding diapers, finding wipes, amidst all the other challenges that are happening right now. So, wow, I just applaud the work that you both have brought and your organizations have brought in bringing so many diapers to help meet the needs of families. So as we think about things along the way, what else I'll start with you, Megan. What else would you like our viewers to know about the organization? How can they come alongside you and get involved?
Mm-hmm. Thanks. So as we have been talking about, we work in a partnership model. So we purposefully align ourselves with community organizations that are doing more than we do. So we are able to give diapers, and which we think is an incredibly important contribution, but we partner with folks who are able to serve families in different ways, based on their needs or perhaps more holistically. So we think that our model is really important because it's helping to serve people more comprehensively. We know that lots of people are struggling right now. And if you are struggling to buy diapers, chances are it's also hard for you to afford some other essentials in your life. And this is an important message that we're always trying to get out, that we consider diapers to be essential. They're necessary for kids to be healthy, and diapers are necessary for parents to be able to work, and to attend daycare, for their children to attend daycare, to go to school. Most daycares require at least 1 day's supply of diapers ahead of time. So you have to have that stock to be able to, have your child attend some sort of childcare, which allows you to work and earn money or go to school. And so supporting Babies Need Bottoms, either by donating diapers or donating dollars or time as a volunteer, it contributes to this much larger picture of how we support families in our community. So, we provide the diapers to these organizations we work with, and these organizations support families more wholly with their needs. And I would say that financial contributions are really meaningful, of course, because we can purchase diapers at a bulk rate that's cheaper than buying them at the store. But it's also very meaningful for folks to donate diapers. We have collection boxes out in the community. Some of the sites are listed on our website, some of the locations. And so sometimes if people want to give something tangible, they want to buy a package of diapers or wipes, we understand that. And that's also really meaningful. And we also have ways that folks can get involved and volunteer with us. So there are lots of ways that you can join us in this work.
Many ways to join a crusade that's more than diapers, as you stated there. Alicia, what would you add to that?
Yeah, I really like that you called out that it's more than diapers. That's something that Megan and I really try to talk a lot about, because sometimes people say, oh, diapers, you just throw those away after you use them. But, you know, from our perspective, the diaper is what makes it possible for, like Megan was saying, for someone to go to school and take their baby to a daycare that requires that diaper. Also, because we're providing diapers to organizations throughout the community, those organizations are able to better leverage their budgets so that they're not the ones going and paying retail, which, you know, retail prices, you might be paying 29 cents a diaper if you get them on sale, but because we have access to bulk purchasing and wholesale purchasing, and we also have relationships with corporate donors, so we receive in-kind donations. We just received literally a truck full of diapers the other day, which is going to enable us to bring resources into Western North Carolina from outside of our region. We've had donations of rash cream, body wash, baby body wash, clothing, infant formula, all of these things that are so much more than diapers that we don't often talk about, but we're able to leverage these relationships. And with the support of local funders, with the support of local volunteers, we're able to help our other organizations that are working directly with families do so much more.
Megan and Alicia, on behalf of the Board of Directors at Pisgah Health Foundation, I want to just personally say thank you both, and thank you to the entire organization at Babies Need Bottoms for all that you're doing to do far more than just diapers in helping these families and in reaching out to Western North Carolina. Thank you so very much, especially in this incredibly challenging year that 2020 is still turning out to be. You know, you're just continuing to rise to the challenge, and we certainly encourage our viewers to get involved and get engaged and support you along the way. And thank you for being a part of today's program.
Thank you so much.
Thank you. Thank you so much.
We also want to thank, of course, and we also want to thank Wildflower Media for their technical and creative support, along with the Board of Directors and the staff at Pisgah Health Foundation and the Physicians Roundtable. And thank you to our viewers for watching. Until we see you next time on the next Pisgah Health Today, stay well and be well.